Thank you very much. My disclosure slide, I am an NHS consultant, but I'm here through my work in my organisation, Plant-Based Health Professionals. We provide education on healthy, sustainable diets, aiming at the healthcare sector and trying to transform food within healthcare. So we know from talks earlier today that we need to at least halve the emissions from the diet we're consuming currently. And the way forward is to reduce the amount of animal-sourced foods being produced and consumed and increase the number of plant-based foods, and swapping dairy for alternatives, whichever you choose is better for the environment. And luckily, plant-based diets align very well with the priorities of the NHS. Please do look at the 10-year health plan for England. It really does talk about health promotion, promoting good health, the continued commitment to net zero. It doesn't touch upon this, but we are concerned around antibiotic resistance and pandemic risk, which addresses the One Health approach to healthcare. Clearly, financials are important, and plant-based diets can save money, and I'll show some data about that. Plant-based diets are inclusive of all cultural and traditional diet patterns, ethical beliefs, and allows you to serve less dishes to more people. And the NHS plan really has a running theme around social justice as well. We know there's huge inequity between access to healthy, affordable food. And plant-based diets would improve the diet quality of the nation. On the left, I've listed some high-level statistics from the most recently released National Diet and Nutrition Survey, which basically shows that virtually nobody is meeting their 5 a day. More than 90% of people are not meeting fibre requirements, and all children and adults are over-consuming saturated fat and sugar. And at the beginning of the year, the Food, Farming and Countryside Commission added up the cost to the NHS and the economy of this unhealthy diet, and it was 268 billion, more than the budget of the NHS. And we've heard today there are numerous benefits of eating a plant-based diet. This is embedded in every single disease-specific guideline I can think about. Eat more fibre, less saturated fat, prioritise anti-inflammatory foods, reduce sugar intake, and this can support healthy living across all ages and stages of life. And we have got dozens of studies demonstrating the ability of plant-based diets, when centred around healthy foods, to reduce the risk of our commonest chronic conditions seen in the NHS. The NHS is an anchor institution. Although food only contributes 6% of healthcare emissions, it is the largest employer, 1.2 million staff. It serves millions of meals at a cost of several hundred millions of pounds. We should be using this as a key opportunity to shape the food environment and role model what a healthy diet is. So we have conducted a consumer survey of 2,000 people in the UK across all sectors and asked them what they think about hospital food. I think nobody will be surprised. Nobody considers it healthy, nutritious, desirable. Only 7% thought of it as delicious. So something needs to change. We'll all agree about that. And only 11% of participants thought that hospital meals were healthy, which is also disappointing. But everyone thinks we should be promoting the gold standard in what's healthy and sustainable. And considering there's only 2% of the population that are vegan, and in this cohort, 35% said that they would support a switch to a fully plant-based menu. Now, I'm not even going to be considering a fully plant-based menu, but just interesting to note that more people, as might be expected, were supportive of swapping out dairy for a non-dairy alternative, given that that's what's happening in our own households, as we know. So, unfortunately, action does not match the evidence. The left-hand side is what is served every morning in my hospital canteen. Sorry, it is your left-hand side. It's bacon and sausage every single day. Another hospital writes, "Nice to meet you," on their way into the canteen. It is depressing. And on the right, you'll see pictures of food that has been sent to me that's served in hospitals when people have asked for a plant-based meal. So bottom left there, you get a banana, some green beans, and some frozen thawed vegetables. Or you could have chips and peas. I mean, it's pretty hideous, and these are current examples. I mean, there's some nicer examples on the right-hand side. So we could do better is the message there. The NHS has a greener NHS section. It sets out guidance as to what institutions should be doing to meet their climate and nature targets, and every trust or ICB has a green plan. We analysed 40 of them, and only 5% said that they would promote and encourage staff, visitors and patients to choose plant-based options. So we have a problem in terms of what the ambition is of the NHS Trust. All green plans are being revamped at the moment, so there's a key opportunity to make plant-based catering a target. We've also conducted a study using a novel scoring system we developed to analyse hospital menus to rate the sustainability, and we've published this. Actually, it shouldn't say in press, it's published by our research assistant Izzy Sadler, and we scored the meals based on, how many meat dishes, plant-based dishes, how much meat was being served from ruminant animals, and quantifying the amounts of processed meat served as well. And the overall message is we are not doing well. All hospitals scored poorly. Even the top-rated hospital scored only 20 out of the available 100 points, and mainly because there was limited provision of fully plant-based dishes on the main menu and high availability of ruminant meat. And disappointingly, every single menu still served processed meat. But hospitals can be the change and lead the way. So we've had a gold standard example from New York City. Over the last 4 years or so, they have transitioned 11 city hospitals to serving plant-based meals as the default option. And this means that plant-based meals are prioritized as the chef special, normalized. Staff can describe them, call them delicious, offer them to the patients. Nothing is removed from the menu, so choice is not restricted. But when presented using behavioural strategies, more than 50% of eligible patients now stick to the plant-based meal. Satisfaction rates are very high. Emissions from the food sector have fallen by 36% in the hospitals, and they've saved 59 cents per meal when swapping an animal-based meal for a plant-based meal. And so we've brought this initiative, the same exact initiative with the same NGO partners, Greener by Default, to the UK. So our organisation is working in partnership with Greener by Default in an initiative called Plants First Healthcare. And this is entirely free for NHS organisations to take up the support to embed these behavioural strategies to support people to eat more plants, essentially, when they're in hospital, to rectify some of the fibre-deficient meals that they are being consumed elsewhere in the house. We've now got the starts of some data coming out from the UK, so shared with permission from the Royal National Orthopaedic Hospital. They've piloted the Greener by Default approach in their staff canteen, really going with climate-friendly ratios, so serving more plant-based dishes, reducing the amount of plant-based meals, positioning the plant-based meals first and foremost with delicious titles, and they've shifted 3,000 meals in their 3 months, reduced the consumption of meat by 33%, reduced emissions by 40%, and satisfaction have remained high. So this is now embedded in the norm. They're moving this into patient menus, and they've swapped out dairy milk for oat milk as the default. And just to reinstate the financial benefits, there were 2 reports published last year modelling the financial savings if, as a population, we move to a plant-based diet, and if hospitals also move to a plant-based diet, what the health-related savings might be. So one report said 2 billion NHS windfall from the positive health benefits, and then just implementing the meat-free defaults like I've described could save 74 million. So if you put all of these savings together, it's the amount that could run 7 hospitals in England or cover tens of thousands of salaries for doctors and nurses. But we face challenges, and some of that has been borne out in our studies. So we've surveyed dietitians in the UK and Ireland, and unfortunately they do not feel sufficiently knowledgeable or supported to embed even the Eat Lancet principles within the workplace, which is disappointing. And so we need to work with all of you who are nutritionists and dietitians, because your professional society do not seem to be currently supporting you in this. There's a real complexity within procurement systems within the NHS, understanding supply chains, contracts. It's a minefield. There's also a lack of ambition from the NHS and the Greener NHS team. Sadly, they are on a different trajectory of replacing beef with venison as their main objective. Well, sadly, it's the truth, and that's what's happening across the country, just swapping out beef for venison. And catering partners, we need to work with the big catering companies, Compass, Sodexo, ISS. And the New York experience was done in partnership with Sodexo, Royal National Orthopaedic Hospital in partnership with ISS. So there's no reason why we can't work closely with them, but we need to show them that there's a demand for this way of reforming the food service. So next steps, if anyone here is working in hospitals, make sure that this is put in your green plans, engage with key stakeholders, sustainability team, lead catering dietitian, your catering partner, contact me or the wider Plants First Healthcare team, and you can work for free with Greener by Default with a UK-based dietitian. And you can also join our global healthy hospital network. And hopefully these slides will be available for you to then use the QR code. So thanks very much. So our report that's available on the app.